scary things are that there are millions of kids who actually are depressed. They actually have good reasons to be angry. They maybe are worrying a lot about things. And these are the kids who are being just easily, 5-year-olds, 7-year-olds, being put on medication. And we now know that there's a lot of strong negative reactions to these medications, that they produce manic responses, that a lot of these school shooters, we know documented over 66 of these school shooters have been on medications, been on antidepressants, been on these psychostimulants like Ritalin, and these are the really scary kinds of things.
Definitely. Well, actually, that brings up a good point, too, because in the president's executive orders that he issued after Sandy Hook, one of the things he said is that they want to get more young people on treatment. It just said treatment. Isn't that like saying they're basically going to put more young people on these drugs, which we know have side effects? They cause hostility, they cause increased suicidal tendencies, aggression, mood swings, all kinds of things?
That's the scary thing. Now, a lot of these kids really do need help, but mental health treatment, at least standard mental health treatment in America, is exactly what you said. It's like if a kid is labeled as depressed, and we know from the CDC in 2011, among teenagers 12 to 17, 3.7% are on antidepressants, which translates out to over 1 million kids in America are on antidepressants just in that age group. And we also know, and this is off of a manufacturer's report, the people who make Luvox, which, by the way, was the drug that Eric Harris, who was a shooter in Columbine, was on, that 4%, this is Solvay, this is their report, it's very conservative, 4% have manic reactions. So 4% using manufacturer's report of 1 million kids on antidepressant, that's over 40,000 kids who are going to have manic reactions. What's that? Poor judgment, impulsivity, agitation, sometimes even delusions, hallucinations. And that's off of the, lots of other folks who've looked at these things say that manic reactions are much higher. When these kids go off of these drugs, which they do because they're kids, they'll withdraw off of them, you'll have these extreme kind of what the antidepressant discontinuation syndrome, which is just a withdrawal response that can make a kid have akathisia, which makes you feel like you're coming out of your skin. And so we know just off of that one class of drugs, antidepressants, we've turned loose thousands of kids who are going to potentially do some things very destructive. And of course, kids, we've got 3.5 million kids in America on these Ritalin, Adderall, speed, ADHD kind of drugs. And we know that perhaps as many as 10% of these kids move into these kind of manic reactions and get diagnosed as bipolar. So there's another couple of 100,000 kids that we've just turned loose out there because the reaction in America today is when kids are having any kind of difficulty, when they're somewhat depressed, often for good reasons, or they're anxious, often for good reasons, we put them on medication, and we're not looking at these horrific adverse effects that when you look at them in the aggregate of these huge amount of numbers, even if they're small percentages like 4% become manic, well, 4% of 1 million kids on antidepressants is a lot of kids who could become manic and dangerous.
I've actually read several things in the last few days that have really disturbed me about SSRIs, one of them being that the fastest growing age group that's taking these medications is actually preschoolers.
Well, I haven't seen those statistics, but we know that in America, when I was starting out in practice 25 years ago, you would never see a little kid on these psychiatric drugs. I mean, the idea of pediatric bipolar disorder was unheard of. It was, the idea of labeling a 3- and 4-year-old with a bipolar disorder just seemed ridiculous. I mean, the symptoms of bipolar having to do with poor judgment and grandiosity and lability, all these symptoms were what people said was what a normal for a 3-year-old. And this whole idea of kids being labeled younger and younger with these kinds of conditions that are just kind of normal. Kids who are 3 and 4 years old who are just not paying attention because they're 3-year-olds or 4-year-olds being labeled with ADHD and be given these speed amphetamine type of drugs. This is all very new stuff in the last 10, 15 years, and it's terrifying. And of course, it's all driven by drug company profit. So when you take a psychotropic drug of any kind, whether it's Prozac or cocaine, all these psychotropic drug means that a drug that affects one's neurotransmitters, serotonin, dopamine, norepinephrine. And for many people who take these, you get the sense of being disinhibited, which means that you just do things that you would never ordinarily do, okay, which often happens when people use alcohol. It's just one of those things that happen when you're not on these kind of psychotropic drugs. Things pass through your mind that you never act on. You're not impulsive. You don't do anything about. But when you're on these kinds of drugs, you're much more likely to act on thoughts you would never act on. And if for kids who are walking around with a lot of rage, that spells trouble. And it has spelled some serious destructive trouble for society, for their schools, and for themselves.
Yeah, and we see these commercials on TV all the time. And when the commercials first started for these drugs, it was more specific about what your symptoms were, and it was like, ask your doctor today. And now it just seems like these commercials say, do you have emotions? Tell your doctor to give you drugs. I mean, it's amazing.
Right. I mean, and they know the people who make these commercials are very, very clever, very, very smart. They're smart enough to realize that they could put on these drug commercials, which, by the way, were illegal in America up until 1997, when the drug company Power convinced the government to allow these commercials on TV. So we're one of the 2 countries in the industrial world that allow these commercials on. And they're very clever. They realize that they could spend 75% of that commercial listing side effects, horrific side effects, if you actually listen to the commercials and don't mute them, which a lot of us do, including myself nowadays. I get so sick of hearing them. But it doesn't matter because the visuals of seeing a person who's upset and hurting and all of a sudden taking a pill, and then the happy music and the happy smile, those are powerful manipulative forces that get people to ask their doctor. And we also know from lots of studies is once you go in and you ask your doctor for some Prozac or Paxil or any of these kind of antidepressants, you're going to get them. You may not have such an easy time scoring benzodiazepines like Valium and Xanax. Doctors are a little bit more reluctant because they've been taught those things are highly addictive. But you can score Prozac, Paxil, from any doctor very easily. Almost like a candy machine. Sure.
When did you become aware that these things weren't actually helping anybody?
When did I become aware of that?
That they were hurting more than helping.
Well, we've known for a long time. I mean, anything you do in life is a cost-benefit analysis. And the scary thing about antidepressants is that we've known for a long time, and now this is finally being revealed in the mainstream press. It's actually 60 Minutes did a big story on this. Is that we know Prozac compared to placebo really doesn't work very well. In fact, in the majority of trials, when you compare Prozac or any of these antidepressants to a sugar pill placebo, the antidepressants fail to outperform the placebo. So in general, the effects, the positive effects of these antidepressants are really, we would be better off if doctors could still give placebo sugar pills. So there's very little scientifically in terms of positive effects, and there's horrible adverse effects. So in terms of a drug having been approved, these drugs should never have been approved when you consider how horrible the adverse effects are and how little any kind of beneficial effects. Now, that's not to say there's not going to be 25, 30% of people out there who take these Prozac, Paxil, Zoloft, who say, oh, it saved their life, it was great. But that's true for sugar pills as well, okay? So you have what we call the placebo effect is mostly what makes these drugs really, really work for people.
Well, I want to get your opinion on this. I actually wrote an article that's up on Infowars today about this. A study was released yesterday that actually claims that people who have major depressive disorder, if they take antidepressants, it will help make their vaccines more effective. That's the new, and it was co-written. There were 20 authors on this study. 4 of them are actually employed by Merck, and the vaccine that they were talking about was one of Merck's vaccines for shingles.
Oh. There you go. So, I mean, that's the thing I think that your audience is much more aware of than the general public, but that all of these studies that are performed on any of these antidepressants, they're all being funded and on all these drugs in general, all being funded by the drug companies. A lot of Americans still have the fantasy that the Food and Drug Administration actually studies these drugs independently, and it's not the case. All of these drugs, the data that is given to the FDA for approval is off of studies that are paid for by the drug companies themselves. And we know drug companies have gotten into some serious trouble over the years, some serious fines because they've held back held back negative effects on these drugs. And also, too, the way they perform the studies. Again, because they've already sunk millions of dollars in the pre-approval process. Once they get to do these studies, there's so much incentive to have them look good that they doctor up these studies. The research design makes these drugs always look much better than they really are. And so over the years, a lot of us have come to see this phenomenon that these drugs have been declared, especially psychiatric drugs like antidepressants, have been declared safe and effective. And then, lo and behold, as these drugs are moving towards the end of their patent, which has happened with Prozac, it's no longer patented, is that all of a sudden you see these studies showing like, well, it's not really that safe and it's pretty dangerous. Why is that? Because drug companies don't care anymore. They don't care when generics can be handed out on them. They want everybody to get all excited about the new group of drugs that they've patented that they can make a ton of money on. So that's been the cycle since I've been a psychologist for over 30 years, that we hear all this nonsense about these drugs being safe and effective and on until they're about ready to go off patent, and then we hear all the truth.
Well, I actually read that America, though we're obviously not the largest country in the world, we take the most psychiatric medications of any other country in the world. Why do you think that is?
Well, a couple of reasons. One is that the drug companies have so much more power here than anywhere else. They're able to get these commercials on television here, where a lot of the rest of the world realize it's insane to expose the general public, especially kids, to propaganda about go ask your doctor if you got depressed. So drug companies have that going for them. They also, in America, are able to throw money at the American Psychiatric Association, throw money at the National Alliance for the Mentally Ill, throw money at psychiatric departments and universities, and almost every way that the general public and doctors hear about drugs, get information about these drugs, is really, if you follow the money trail, not that far you have to follow it. It all comes from drug companies. So it's very rare that anybody is getting any kind of information, seeing any kind of studies that isn't drug company backed. And so, and think about it, if you were running a drug company where you had products like even these antipsychotics. I'll give you an example. I've written a lot about Zyprexa, which is made by Eli Lilly, which that was their big money maker after Prozac. And so Zyprexa has achieved $4 billion a year, $5 billion a year. This is a huge amount of money. And when you know that your product could potentially make that kind of money, to throw $1 million here to a university department, a couple of million here to an institution, or throw a couple of million here to somebody who's leaving National Institute of Mental Health, who's been friendly to you, this is chump change. So they're spending a little bit of money. They even tolerate huge fines against them, which is also the case. They were busted for off-label marketing this Zyprexa, which means they illegally marketed this antipsychotic to people, to doctors, to use for kids who weren't psychotic, to use for old people who are disruptive in old age homes. You're not allowed to do that. It's illegal. It's off-label marketing. But so they get fined $1 billion. Well, that's about what they make in one quarter for Zyprexa. So it's all about, these drug companies are smart enough to spend a few bucks here to make tons of money elsewhere. And you can pull that off in the United States of America.